suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Does it look irritated?
No.
Honestly, not at all?
Not really, no.
So I'm going to get reception to call an ambulance, all right?
I was wondering if it might be possible to have a little wee for me.
That's so little.
I know.
That's so little.
I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Okay, here we go.
Take a seat for me. Right, I think you spoke to my colleague Dr. Sayer earlier on today and saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay. Is this something you've had before?
I used to have really bad depression, like from when I was 17, I got diagnosed with it, but lately it's just coming back. Like I don't want to leave the bed, I can't eat, I'm not.
So nothing's changed in life or nothing new, it's just...
It's literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't, like, earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
So like I might need a few days just to gather myself, and it's something that's documented that I've struggled with for years, but right now I'm scared that it's only going to get worse.
Okay, all right.
When I was younger, I would literally lock myself in the bathroom and they would have to call like the police and stuff to come and get me out, and I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well look, most people have started on either sertraline or citalopram.
That's the one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you, though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those?
Yeah.
Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder because what propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay? Like you did today. If things don't improve, just give me a call.
Perfect. Thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
My asthma's been quite bad recently.
Could barely breathe, just really tight chest.
And then, all of a sudden, I start to cough. I was short of breath.
I felt like my whole chest was like a balloon that just had too much air in. I couldn't get it out.
So it just like, instantly I'm just like, I can't breathe.
So your asthma is not good?
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. Yeah. How long have you been like this for?
It was bad last week, and it felt a bit better. And then probably, I think, Friday last week, it felt not so good. And
How many puffs have you had today?
about 6.
Okay, I'm going to get you a nebulizer now so that we can talk a bit more, okay? I might need to come and sit here, just so you're next to the... I can plug this in. All right, when ready, I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for? Today and is today? I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. We're going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
Severe asthma attack.
She's got respiratory rate is 60, despite a nebulizer tell them, so they need to come in now.
If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly.
She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again from what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days. Despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebulizer. She's still got a respiratory rate of 60. All right, I hope it gets better soon, okay? Thanks, guys.
No.
Thank you. All right, thank you guys. Good luck. Take care. Poor love, she's breathing so she's terrible, so fast. Really frightens me when they're that bad, because, anyway, poor love.
Relief in one sense, when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability, and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late, because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.
Hi, how can I help? I've just been waiting a while now. Didn't know if you got me.
Yeah. So, because there was a medical emergency a while ago.
Yeah,
you'll
you'll
be
be
next. She just seen someone else. Sorry about the delay.
Don't worry.
Thank you so much. Bye. I can't decide if my headset's playing up or I'm speaking to a lot of deaf people today.
What do you think it is?
I think it's the headset. But then I speak to somebody else and
And it's
everything's
fine.
fine.
Yes. One of them wouldn't lose.
Do you like stickers?
Yeah.
Do you think you'd like a sticker?
I would like a sticker.
Oh,
Can I have
a sticker? Yeah, you can have a sticker.
For you.
Even though you didn't have an injection, which one would you like?
Now, would you like a sticker?
No.
No? That usually works.
Come in. Sorry? Oh yeah, of course you can have a sticker. Look, I've got flowers, butterflies, cars, dinosaurs. A dinosaur one, I think that's a great choice. There you go. Can I have a high five? Very good.
Right. Are you going to tell us what's the problem, or are we going to leave it to your dad?
I don't know what the problem is. Mummy might. I know what the problem is. So when I was at school and the door was open and it got really cold, then I was cold, so I put my jumper on, but that didn't work.
Oh, okay.
But everybody else was in t-shirt, weren't they?
Yeah.
So you were feeling cold, were you? Because I mean, it's been sunny the last few days, hasn't it? So, do you feel any pain or soreness or?
I'm okay.
You're okay. You're fine. Can I get your dad's take on things?
Yes.
See what he reckons.
Obviously, they saw him putting on the coat when everybody else was sweating. So they took his temperature and he was very hot.
Okay.
They gave him some medicine, but as soon as the medicine wore off, he spiked again.
Yep. I was wondering if it might be possible to have a little wee for me. Let me give you a pop.
That's so little.
I know.
That's too little.
It's practice, isn't it? I'll set you that task if I may. Any success?
We have.
Oh, look at that. What I do is I just dip my little bit of paper. It's quite clever stuff, really.
That easy, isn't it, Dad?
Yeah.
It's easy being a doctor. Okay, there's no urine infection.
Okay.
I think where it's coming from, it's a viral infection of the upper respiratory tract, and there's a tiniest little bit of redness in the ear at the back of the throat, and he's got a few lymph nodes up there. It's almost certainly going to settle down on its own.
Okay.
So it's just a question of keeping an eye on him over the weekend. So keep him well hydrated. Calpol's absolutely fine. These kind of things usually take between about 5 and 7 days to settle down completely.
Cheers, thank you.
Have you got any questions for me?
Have you got any stickers?
Right, what are you going to have?
Bye, Dad.
Okay, cheers. Thank you very much.
Nice to see you, both.
Thank you.
Take care.
Thanks a lot. Cheers.
It's a pleasure.
Bye.
Bye, take care.
That was easy, wasn't it, Sam? That was easy.
Yes, well, it wasn't a test. He's just trying to make sure that you're okay.
Yeah.
Does it sound any different if I talk to you on this?
I can't hear at all.
Ah. And you can hear me okay on this one?
Yeah.
Okay, thank you.
You're welcome. Antonio speaking, how can I help?
Hello, Miss Morey. Hi. How are you?
I'm not too bad now.
Okay.
If I have something to eat, and then I have to go and pass a stall.
Yeah.
The pain that I get, it's like you're open, but you're not closing up. I don't know, like it hurts a bit.
But no bleeding from the back passage or anything like that?
No. That it can happen, but that's very, very rare.
Okay.
That's just rare, that is.
And we spoke last week, obviously, about alcohol as well.
Oh, yes.
And that's still something you're taking daily?
Not daily, but every other day or every 3 days. Yeah, I do. And my roll-up cigarettes.
Yeah.
You know. Personally, doctor, I can't see that changing, really. The only other thing I can say is my diet is very, very poor.
Yeah.
Because I do not stick to a proper diet. I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Yeah.
I don't want anything else. I have no desire for it.
And you said last week, there wasn't any problems with any food sticking or anything like that?
No.
No problems with swallowing?
No.
And obviously haven't got a huge amount of weight on you?
No.
But you hadn't lost any weight or anything like that?
No, not to my knowledge. No.
Not to your knowledge. Given the fact that you smoke a fair bit and drink a few times a week, we know that there's an increased risk of things going on in the stomach. And that includes things like stomach cancers. Okay.
Yeah, I've thought about that.
Yeah.
It won't hit me like a ton of bricks if I find out something like that. I've had a good innings.
Yeah. But I think we should investigate that a little bit further. Even without those blood results to look at, I think we should be referring through to the hospital for somebody to pop a scope into the stomach to have a look. What do you think about that?
Yes, but why not?
Because we've talked about things like stomach cancer, it's something that the NHS really does investigate very quickly and very comprehensively. Do you think that's something that we should refer you for?
Yes, I think so, Doctor.
Yeah. I think that's important.
Okay, then.
How's it going?
Kim, Erin and I were saying you've been so... You look like you two were kissing and then you turned around. Erin, like, she cool.
Hi. Oh, careful. Sorry you had to walk a bit further down. How do you think I feel?
Oh.
Been a while since I've seen you, hasn't it?
Yeah.
Lucky you.
I know. Let's hope I'm going to be bloody lucky
Have
now.
you missed me?
Oh, yeah. Well, I miss you, but not miss coming round here.
Can we do your left arm? Because I know from previous...
I know.
I think I know your arm better than you do.
You don't. Oh, that went in nice.
Didn't even feel it, did you?
No, I didn't. See, that's why I like you.
That the only reason?
No, I like you as a
I was going to
person,
say.
And as soon as you got that colour...
using me for my blood technique.
Definitely.
You like my hair colour then, he said?
Yes, I do. I used to be that colour when I was young. A natural colour, though, it was, until I...
Have you ever seen my natural hair colour?
No. Black. Brown.
Ginger.
Ginger? Not a bit of an Irishman, are you? Any holidays yet?
Yeah, I'm going away in 2 weeks. Where do you think?
Turkey.
There you go. You know me so well. GP surgeries do become like an extended family for elderly people because they do come in a lot more than some younger people. So they do get to see like me, a healthcare assistant, a doctor and a nurse. And they have different relationships with all of us. So that is like a family in itself. So I'm probably like the little naughty grandson, and then one of the nurses could be this. You know, that's how they see it. And it's like a day trip for some of them as well. They get a bus in together, some of them. So yeah, it's quite sweet.
Well, my niece got married, not last week, the week before, in Spain. So I've got another one getting married in Spain next year.
Are you going?
No, I never went to this one. I said, I won't be able to come to that. We'll get you a wheelchair at the airport. He said, we'll get you there. But
I need a wheelchair at the airport as well.
I need a wheel. I need everything at the bleeding airport.
By the time I'm done on the plane, I need one.
Taxi there and taxi back and come.
Oh, lady of leisure.
Definitely.
Look at you.
Well, you know why I say I might as well spend it because they'll spend it when I'm gone. Nice seeing you.
Oh, you too. Always lovely to see you. Take care.
Will do.
You got a paper?
Yeah.
I want that crossword finished by the time I come out there.
Yes, take it home.
Thief.
Bye-bye.
See ya. Even from when I was on reception, I always thought, try and make somebody leave here happy because you never know what they're going in to see the doctor for. It could be anything from bereavement to cancer. So making somebody's time here happy, I've always thought is very important.
Erin speaking, how can I help?
Right, have a seat. What can I do to help?
I had some fertility tests last year and I got given the results. It was when I was with my ex-girlfriend. I went to a specialist and he explained that I was kind of slightly below average but in normal parameters. But then when she went back, there's another doctor that she spoke to who said, no, the specialist is wrong. You need to get a second opinion. And they said, yeah, those results are on your record, so you could explain them to me.
Right. So we're wondering if you do or don't have a problem with your sperm.
We are, yeah.
Okay.
I mean, looking at some of those numbers to me, obviously it looks devastating when you look at the low figures.
There are two numbers which are not as high as we want them to be. The first is the number of sperm which are swimming in the right direction. And what you want is more than 32% of sperm to be swimming in the right direction. And only 21% of yours are.
Right.
The other thing which is not ideal is this number of normal forms. What that means is they look down the microscope at the sperm and see if they're the right shape.
Yeah.
They didn't see any of yours which were the right shape. So I guess we've got a couple of choices. I think there is a lot of variation in these samples, so you could do a third test. Another option is for me to contact a urologist and give them all the numbers and say, what's the situation? This is one interpretation. What does this actually mean?
Okay. Well, that's definitely the first step for me. And can he give me more of a breakdown as opposed to just a, you know, I don't know, just sort of more of an explanation, because I still don't really understand that.
What would, in an ideal world, what would you want them to be able to say?
I want to say you've got this percentage chance.
Of having a kid?
Yeah.
Okay.
I think anyone in their right mind would want to know.
Yeah.
I want to have an idea.
Yes, I understand where you're coming from.
You've been in hospital, you had your tonsils taken out first of all. One, the right side, yes.
The right side, and I'm too beg your pardon, sorry.
That's okay.
It's been in constant pain ever since, and then about 3 or 4 days later, I just cleared my throat and an enormous volume of blood suddenly appeared.
Oh my goodness, okay.
So I had to call the 999, taken back to the hospital.
Thank you, Bridget. Okay.
Initially I was scared it might be an internal, but it wasn't. The bleeding was actually
From there?
From there.
Okay. So you've got here, seeing the Royal Marsden Hospital this Thursday, okay.
He's going to have, I think it's 20-something, lots of radiation.
Yeah.
And then the second for 5 days a week for 6 weeks.
Okay.
And he's also going to have chemotherapy.
That's a lot.
Just a damn sore throat, that's the known bit.
Okay, so it's the pain that's the biggest issue for you at the moment.
It can be, especially at night time.
You're on the omeprazole, the propranolol,
yes.
The calcium and the vitamin D, and then the bone alendronic acid once a week. And then importantly, painkiller-wise, is the cocodamol. If it's difficult swallowing tablets, do you want to keep it as a tablet form?
I prefer, I had a choice of that or up my bum.
Oh, John.
I did. So I quickly learned how to swallow it.
As an alternative, a third option, you could have dissolvable tablets or liquid.
No, I'll stick with the tablets.
The tablets, you're okay swallowing
absolutely.
them? You can make them a little bit stronger if you want.
Just slightly stronger.
Slightly stronger, yeah.
But again, just for the occasional rise.
Just for the occasional, yeah.
Absolutely, no other reason.
What else do you need to...
No.
Yeah.
My sister, one of my sisters, she's critically ill in Ireland.
You told me on the phone, yeah.
Charles is my first priority, obviously. I can't leave him at all, and I wouldn't. But I need to go over to Ireland if I can. If Charles's sister came and stayed, which she will, all the time in the house with Charles while I'm away, do you think that is...
I think that's fine.
It is.
I think that's absolutely fine, completely.
Yeah.
If Charles was happy with
absolutely.
it.
Yeah.
Absolutely.
And you have...
Absolutely,
yeah.
of course.
It would only be for 2 days.
Okay. You know, your sister, she's very unwell. She sounds... And you need to...
Yeah.
You need to go over, and if you've got somebody... Not that Charles you need looking after, but I think it's nice to have somebody else there. You've had a very difficult time and you're going through a lot, and if your sister can come and help...
patient.
You're not a difficult patient. You're not at all. We would like to support carers as much as is possible. It's often a very It's often a very unrecognised role across the UK. They estimate 6.5 million people are carers in some form or another to friends or family, which works out at 1.1 in every 8 adults in the UK. So it's a huge proportion of people. Often people might not recognise themselves that they are carers. They may be providing a caring role but not think of themselves as a carer. So one of our roles is to try and identify people who are providing a caring role and try and support them as much as we can. I think you're coping, from what I can tell, very well. And I know
good Lord, I've got a lot to do yet. Right, but we won't
Sorry,
take any longer. Thank you
no,
so
not
much
at
for your
all.
time.
Perhaps we could see you again maybe in about 2 or 3 weeks.
Oh,
we could
great.
do that.
Yeah,
and then,
that's very kind.
But anything in the meantime, I'm
You're
happy
so
to speak
kind.
Not at all.
Thank you very, very much indeed.
No, okay. All right, bless you. Oh, okay.
Thank you.
All right.
Thank you for all your kindness.
You're very welcome.
Take care. See you soon.
take care.
See you soon.
Okay.
Bye now.
Bye-bye.
Bye-bye.
All right.
Vicky, I'm going to win the lottery, okay? I just thought I'd tell you.
Just in case you do, I just want to let you know how much I like you.
Who are you?
If you feel you need to be seen, I can arrange for an on-call doctor to call you. If they need to see you, they will arrange a time for you to come in.
Perfect.
To practice.
Yeah, practice it in front of the mirror.
Hello.
Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This time last year I was flying away to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. He had to have 5 units of blood.
How are you?
I'm all right, having bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, the sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath, and he just went. His eyes and his
Roll
throat
backwards.
And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me. I'm out, but I just thought, what am I going to do? But anyway, I know, but I'll be all right, I have to be.
I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a Carers Association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling. And I think that's an important outlet for her.
I can't fix my hair up.
Brush it.
I have.
No, you haven't, Pa. Brush it properly.
Watch.
That's not brushing it. It's not even black. How are you not? This is brushing.
Yeah, but ow!
You have to brush it. It's called brushing.
Don't. You're hurting my scalp.
Oh, shut up. See, that's what it's called
Yeah,
brushing.
but I don't want it flat like that.
It looks nice. It was sticking up before, like the Mad Professor. You look like the Nutty Professor.
You are the Nutty Professor.
It looks nice now.
Yeah.
Mr. Morey, hi.
Hello, Doctor.
Hi, come in.
Thank you.
Come in, take a seat. Okay. And Miss Moore, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said that we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always the possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. And now I'm 59.
Okay.
And I thought there was something in this.
Yeah. This type of cancer in your stomach isn't one that typically is very aggressive or anything like that.
But it is a cancer.
It is a type of cancer, yes.
Ah, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay? Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from... Let me show you the letter from the hospital.
Yeah.
So...
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
You take your time. Do you want a glass of water or anything?
I'll have a glass of water, please.
Let me get you a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There we go.
Thank you, Doctor.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today. Yeah. And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh, no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things and I've got over everything. But I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing. And there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said, the big C, to quote, how long would it take to happen for me to,
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So this type
because I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, you know, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now. I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh yeah. Make no mistake.
It's Maureen. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when
Yes.
we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, you know, if you've got any more
Today?
questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor.
Okay.
If anything happens to me, in the meantime or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's, you know, the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Ed.
Okay.
Thank you very much for your time and your concern.
No, not
I
a problem at all,
appreciate
Mr. Roy. You know, these are the most important times.
Thank
and
you,
that's
Dr.
why that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be
Okay.
here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then. Shit. Shit. Hi, Dr. Barker. It's William Laird. I've spoken to him about the results. He was quite distressed, so I'm quite a little bit on edge at the moment. But I hope he will come and see me at 1 o'clock. You know, but then I'll panic a little bit if he doesn't. maybe I'll pop round the corner to see if he's at home. Yeah. Pleasure to talk to you once again. Thank you. Bye then. Bye. I think breaking bad news it's always a complex thing, whether or not you've known the patient for a matter of days or hours or months and years. It's just unpredictable how you're going to respond to this and how they're going to respond. And it's really just trying to provide information and let them know that you're there for them at their time of need.
I didn't win the lottery.
I still like you though.
Yeah, I'm not going into the. I'm not going to go to the meeting.
Okay.
If my patient comes in, you just let me know.
Okay.
He said he might come. He said he'd come back at 1 o'clock.
Which patient's this?
Mr. Murray.
Okay.
So, let me know when he gets here if he does.
Hello,
Hi.
Anna. Come and have a
Thank
seat.
you.
How are you? What's happened?
I don't know, my eye, and this, I think I might have been a bit overdramatic coming straight to you, but one of my eyes, it just started like, it felt like there was something in it. And I've spent ages putting my finger in it, which obviously hasn't helped. And then I thought that it seemed like there was something in it, but it looks like, I don't know, you look at it and you tell me.
Right.
It felt like there was maybe some like fluid, it was been really watery, but then it seemed like there was some creamy coloured,
Discharge.
yeah, but not much.
Okay.
And then that bit there seemed really red, but I have poked it a lot because it was, I mean, it was just literally, my eye was just watering because it just feels like there's something stuck in it.
Okay.
How does it look?
Looks okay. I'll have a look in more detail though.
Okay.
I'm just going to pull your eyelids down a little bit. Look up for me, and look left, and look right, and follow my finger with your eye. Okay, come and have a seat for me. So,
There's nothing wrong with it, is there?
well, I can't see anything there.
Oh, okay.
I guess you've got this sensation of your eye being irritated and
Yeah.
sore.
Does it look irritated?
No,
Honestly, not at all.
not really, no.
Oh, I've spent all morning looking at it. It feels like something here is like rubbing every time I'm moving my eye around, but obviously not enough for me to not want to move it. Do you know what I mean?
I do. I mean, if we were going to completely exclude a foreign body having scratched the front of your eye, I guess we would need to stain your eye with fluorescein and look at it under a blue light.
Yeah, that seems a bit much considering I feel like I've never rubbed, there was never an opportunity for something to actually go in it.
No,
Okay.
I agree. It feels like a bit much
It does feel like a bit much.
because your eye essentially looks completely fine.
Yeah.
Good morning, Nana speaking. How can I help?
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle. It turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It just doesn't feel like it's getting better.
Unfortunately, so the thing is, like, the laryngitis is typically more with the loss of voice. It tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route or anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, it's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice? Or...
Going to Lisbon for a hen weekend.
Okay. Yeah. Hen weekend like this? No.
I organised it, otherwise I wouldn't
Not the best combination, unfortunately. Stand up. Let's have a listen. Let's have a listen on your back. If you is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from last time? Where it was sort of...
I just had a sore tooth, but by the time I got there, it turned into like a wisdom tooth. And I just went, oh, nothing was open because it was Easter.
Yeah.
And I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this Henry County.
Can you say limiting?
Well,
realistically.
do as you feel is right.
Okay. Is there anything else I can do?
Things, you know, sort of sometimes, you know, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It's just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time. It's really the key.
With the flu that I've had.
Probably just incidental. Your immune system was probably knocked with the flu, and then you've developed this infection.
All right, thank you
So,
very much.
yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, sort of a standard set of signs and go from there. Take care. Take care. Bye then.
What's your date of birth, please? Oh, happy birthday! Come and have a seat. I'm Dr. Beecroft. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
Just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. Okay. I was just like, and I've tried everything that I can possibly get just over the counter. Yep. But nothing just seems to work anymore, and I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision and makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah, blah, blah. And it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them, out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. I hope it helps.
Yeah, thank you so much.
Okay. All right, have a good
Thank
day.
you.
Bye.
You too. Bye.
So come in tomorrow at 12 and then I'll help you with your registration, okay?
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
And come and take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine then?
Yeah, I'm using it. Like,
and you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in and around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. I know I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here? No. Around the elbow? No. Okay. So I'm happy with everything bone-wise in here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin. It's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here, has just ended up around here. And
Okay.
the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just to get it
What's
checked
it
out.
getting up to?
Yeah.
Exactly. Well, you can be relaxed.
Cheers.
Okay, take care. Have a good evening.
I mean, that's the
Showing here.
most terrible bruising I've ever seen.
And no other reason?
No. I don't remember.
No falling,
I mean,
no
I
injury, no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So
Yeah,
if
you
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it to cause this.
But that's the shoulder. But this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly. Don't know what
Yes.
you know.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis.
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need two. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
sun.
no more trips to
and a
Ibiza.
hat. No more trips to Ibiza. All
Thank
right.
you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Shaw.
Yes, thank you very much indeed.
Bye-bye. See you.
My belly's just bloating. Should I just stop eating wheat? No, I'm gonna bring in my what's that tea?
Green tea.
Yeah.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle. Like, go to the gym like 4 times a week, eat really healthily. Like, I don't eat any overly like refined carbohydrates or anything like that. Super healthy. However, in the past month, recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant.
Okay.
Every single time, even if I'm only having like a bowl of soup, just blows straight up and it feels really tender.
Okay.
And it's getting to the point it's just so uncomfortable. And at night, like, I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. So, okay, accidentally had pasta last week. And literally I was sat there at work and I just couldn't do anything. You know when you're just all cramped up? It just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too
No,
soft?
like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I
without
think my
trying?
weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Does anything run in the family at all? Any bowel problems? Celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there.
Yeah.
Okay. And here.
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer.
Oh,
because it really hurt.
I think your symptoms, a little bit like irritable bowel, what you're
Yeah.
describing. Often people with irritable bowel tend to have some sort of bowel upset, so
Yeah.
either diarrhea or constipation. You don't tend to have that.
No, no.
So it's more kind of just the bloating and
Yeah.
things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I
and
said,
sometimes
so-
it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's
but it's,
exactly what I was confused.
You know,
So
things that can cause bloating are apples and pears and artichokes and beetroot.
absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect.
Point,
Thank
I
you so
think.
much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
Keep
tend
looking
to
like
be
5 months pregnant everywhere I go because I'm so little as well. It just looks
Yes,
absolutely
yeah.
ridiculous. That's
Okay.
great. Thank you
All
so
right,
much.
pleasure.
Thank you.
Okay.
Hello, could you please give the surgery a call regarding your appointment this evening and speak to reception?
I don't speak to
I'm fine. What can
Be
I do?
asking that, should I? You should be asking me.
What can I do for you?
I'm actually need a favour. I've recently swapped into a ground floor flat.
Yeah.
And you know I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards, I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night, and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Why not?
They just, I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it's obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local councillor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
So my next appointment with the doctor is Friday. Do you feel able to wait till then?
OK, so I've booked you in 4:30 with Dr. Laird.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides, it just depends. I don't know. They just come and go. I can eat a horse and feel all right. I can eat half an horse.
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here. I will go through it. So, then I'm sort of like...
Having a good yawn?
I'm having a very good yawn. I'm making up for like the last 4 in one go.
Okay.
With the last 4 average yawns. I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good. We'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods.
It's mostly
or
cereal.
Microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call not chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, if it was like 30 gobstoppers.
When you've eaten 30 of these things. when you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. You know, so I don't eat a lot. Oh, I drink now and again. I do eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans and then
yeah,
drink.
the cans are ongoing, right? But the thing is, going out of session is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day,
no,
15 pints?
I'd go more than 10, but I wouldn't say... I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
The lungs seem to be working, don't they?
Hiya, I've just lost Lily. I think she might have gone to the toilet.
Oh, okay.
So she's fine. I haven't looked because she's just been taking her weight and all preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Oh, Rhoda.
I broke my leg. No, that's
Right.
Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, okay? Let's bring you back down a little bit.
She's a very active little girl.
Okay, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a series. Like, there's more of them.
Can I have a little look in your nose? Is that okay? Yeah? So, what's the longest without a nosebleed? A few weeks? A month, maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is, I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80.
Just relax your nose. Don't scrunch it. Relax.
Is it gonna hurt?
No, it's not gonna hurt.
I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating. What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, okay? 4 times a day for 10 days.
10 days?
Hopefully that will stop the nosebleeds.
Be sad. 94649.
Wow.
We're happy. All right, there we go.
Lila,
Okay.
you've got to stop. You've got to stop now.
All
Okay,
right.
thank you very much.
Bye-bye.
Bye-bye.
If you feel he needs to be seen, I can ask the on-call doctor to call you.
No, you're full of stress.
Wouldn't you be stressed? Can you put yourself in my situation?
I know.
Instead of ganging up on me?
We don't gang up on you.
You did.
We just want to help you.
Even
Take
Chelsea brought.
Take the stress off.
Come in.
Pleased to meet you, mate.
Hello. Please do all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take his way, can you?
You can't. What can we do for you
Well,
today?
what happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after half an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good, lost a bit of weight, looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, but he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor.
That's right.
To have another examination.
That's right.
There we are. Well, we can sort
Slot in
that
around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know, can they cure floaters?
No.
Kind of thing now, instead of turning my head suddenly, I might get a little arc, like flash, but I've got a floater there now, but I'm kind of learning how to put up with this.
Yes.
Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment.
What I'd like you to do is, on the way out, if you hand this to reception so they can photocopy it,
That's fine.
and I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, and thank you very much.
I don't know what's causing it, but essentially my mouth is very sweet.
Very sweet.
Yeah, it tastes like I've always got sugar in my mouth.
I have to say it's a completely new one for me. I've never heard anyone say that before.
I couldn't feel anything here and here. It's like when I had anesthetic.
Did you have swelling on your tongue as well, or just the mouth?
Not the tongue, just
No,
the
and
mouth.
your breathing was okay?
Well, okay.
Okay.
Every night this week, nothing, except for last night.
All right.
It started again last night. I thought, well, what's going on here?
Feels like something's going to pop out of my ear.
Okay, nice.
You have your tea, you're not drinking your tea.
Coffee it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
And when I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees?
Both knees. And
Elbows?
elbow. And when I do like that, when you do like that, I wanna,
What do you mean?
but when I breathe in, you could feel a pain around here and all that.
Right. Is your vision normal?
Yes, a vision. You know, sometimes I get the vision. Sometimes, like, the light, not this kind of light, like the bulb.
Yeah.
The bulb like a zigzag, but it
A halo.
What is it? No, no, halo is round.
Oh.
This is not a round. It's like a zigzag.
Okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't really. I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right?
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, yes, when you press.
At the back?
Right there, sir. Right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the edge for me.
like somebody was bashing me. Oh.
All right. Can you put both hands behind your head for me?
Yeah.
Can you push your elbows back? Does that hurt?
A little, not much. A little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see, oh, this one's there.
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cold. Feel my arm.
Oh, yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
All right.
Why I wake up with this pain?
Sit here for me. Lovely. Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954.
Right.
So it's going to be a long, hard job. I've cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator and the you know, the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum. Because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah. Probably.
You're going to give it a go?
Oh, certainly.
OK, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me? Yeah. Thank you, sorry. I've got my colleague with me because his machine's working
Hi.
and mine's not.
How are you?
So this is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. OK, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you
That's
stop,
it.
that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah. So the plan of action will be I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum,
Yeah.
will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on then.
Come and have a seat over here again.
What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. Oh, I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50.
So I think the way to do that is with a blood test today. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
Oh, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one. Oh, how old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah, room 1. Hold this for me, please. I can get them. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Thank you very much. Pleasure. I hope you feel better soon.
Okay, thank you.
Okay, wonderful stuff. Take care. Thank you.
Nice to see you. Bye-bye.
Bye-bye.
Would you say thank you to the doctor?
You're welcome. Are you going to let your mum put the cream on so it gets better? You're welcome.
Brilliant.
Right.
Thank you very much for that.
Okay,
That's
nice to see you.
Nice to see you.
Bye-bye.
Thank you.
Bye, thank you.
Morning.
How can I help?
Okay, that's all booked. Bye. It's going to be a good day, Nana.
So anyway, how are you getting on?
Well, I'd like to ask you a question, whether you can answer it or not, I don't know. And that's the nicotine, I think, from smoking, has lodged in my arteries.
It's not the nicotine that's doing that to you. It's all the rest of the rubbish that's in a cigarette and chemicals.
Yeah, it's it's a fine dust, basically, isn't it, smoke?
Yeah, well, it's killing you. And that's what's going through your arteries. How many cigarettes have you smoked since you saw me Thursday?
4, 8, about About 12.
Okay, so I thought you were going to use the patches and the gum and not smoke. That was the idea of this.
Well, I did, but I cannot resist.
So you're still craving for cigarettes. So then the regime that I put you on is not high enough. You've got a 4 milligram gum. Have you been using the gum?
Well, I don't like to criticise it, but it's inclined, I think, to give me like indigestion.
Yeah, it does. It can do. It can do.
You know about that, okay.
How about a lozenge? I tried to try a lozenge instead. So what you do is you suck it and you park it, you suck it and park it, and you keep doing that.
What flavour are they?
Mint.
Oh, yeah.
Is that all right?
Yeah, that's fine. Very limited on that, I expect.
Oh, there's not a lot of choice, I'm afraid.
No.
Okay.
I'm not being picky.
Okay.
I'd like to try them if I can.
Okay, and I'm going to up the patches, so 5 extra milligrams in it, and we'll see if that regime helps then.
Okay.
So, are you going to come back and see me next week?
I have to check my diary.
Okay, well, I'll make a new appointment because you need to see me. This is something you need to come back and see me for.
Okay.
All right?
Yeah.
Hey, little man. Hello. Hi. Hi.
I'm so sorry. Yelp if you need me to.
Oh. It's all right.
But we're just concerned that he doesn't seem to be...
It's tough coming into the big world, isn't it?
Calming down and gaining weight. He has gained weight.
So what are the things that you've noticed, Barbara, that make you worried about Sammy?
So there was lots of things which change. So, for example, you are more energetic than usual. So it seems like the actions are much stronger than usual. Also, you sleep with service charges, which never happened before.
Sorry, what was that?
Stopped paying service charges, which is very unusual for
okay,
you.
so you have to pay service charges?
Yeah.
But you're not doing it?
No, I'm just behind in arrears. But in a week's time, I'm paying about £100 towards that.
How did that happen, that you got in arrears?
I just slipped behind in payments.
Right, but then you must have spent the money on something else.
Yeah.
So what did you buy?
I just bought shaving, grooming kit.
Must have been a lot of money on that.
Yeah.
Why did you spend so much money on those things?
I don't know.
Do you really need them, all of those things?
Yeah, because I groom every day.
Yeah, but you obviously you used to be able to afford to buy what you needed and pay the charges.
Yeah.
But were there other things that you bought?
Some shirt, t-shirts, underpants, and cologne.
All right, okay. Bipolar disorder is usually really quite a severe mental health problem in which your mood can either be very high, which is we call either manic or hypomanic, or really very low, depressed. People become hyper. They often buy loads of stuff. Often people buy things that they can't really afford. They may think that they're famous. I had a patient who bought a ticket on Concorde because he thought he needed to go to the States straight away for no particular reason. I mean, obviously, you've been living at the hostel there for a long time now.
Yeah, 5 years, 4 months. No, today it's 5 years, 4 months.
Is this the first time you've been in arrears?
Yeah, first time, yeah.
So something's not right, is it? Because you wouldn't normally allow that to happen, because you're very responsible.
Yeah.
The worry that I think Barbara has, that you're beginning to show early signs that you might actually be relapsing.
No. Because the thing is, I saw my consultant psychiatrist on Saturday.
Did you?
Dr. Potter. Yeah, I saw him on the street near where I live.
All right.
And he said I look very well.
Right. You can't tell what's going on inside your head from just looking at you, because I would have said you look very well as well.
Yeah.
And the thing is that what we know with the kind of problem that you have, that when people relapse, the first thing that you notice is not that they don't look well. They look fine. And it's just what they're doing isn't quite normal. I think that these are warning signs. If we don't do anything, you will get ill. And we really don't want that to happen again because you've rebuilt your life. You've been absolutely
Well, today
fine.
is 5 years, 4 months
Yeah.
since I was discharged from the hospital.
Yeah. So you've done.
And within myself, I know if I was going to feel ill when I was.
Okay, is that really the case?
Yeah, I know.
That you know? Because most people with your illness don't.
Yeah.
It's very unusual for people with your kind of illness to know. It's always other people who say you're not well, and that you have to then accept that they're right, and that means you should be on treatment.
How do you feel about that, Sammy?
Well, at the moment, I don't think I need any medication. I think I've done well 5 years and 4 months since March 29th, 2010. I was discharged from the hospital.
Yeah.
I motivate myself, I go for walks, my weight is coming down. I don't think I need any medication.
Right, okay.
I definitely don't think I'm getting ill.
Right.
I feel well within myself.
Okay, well, our advice is you aren't the normal Sammy that you were a few weeks ago, that you've changed. You aren't as well as you were. You can't notice that, you can't see that, and that's often the case. In Sammy's case, I thought it was really important that he should be on medication now because it sounded as though he was beginning to relapse, and that could have been disastrous for him as he might have ended up in hospital because he wasn't taking any medication for bipolar disorder and hadn't been taking any for quite a long time. We would generally say to somebody like you really ought to be on medication forever. When you get ill, you get seriously ill and you end up going back into hospital. It's such a huge setback if that happens. We think we can avoid it now. All you need to do is to restart treatment. He is a patient, actually, he does get the final say as to whether he takes medication or not. He's taking a chance if he doesn't take it, but then maybe he's entitled to take that chance. Are you willing to see the psychiatrist?
I'm willing to see the psychiatrist.
So we'll do that. We'll do one step at a time.
Yeah.
I do think it's worthwhile going down this route. So what I will do then today is I'll phone them up. I'll try and arrange that you get an urgent appointment to be seen as quickly as possible. I'm sorry, you're obviously upset about that.
Well, I'll see the psychiatrist, talk to him.
Yeah.
He can assess.
Yeah.
He'll assess me, and then he'll tell me if he thinks I'm getting ill or not.
Yeah. Okay.
I think it will be the best thing to do.
Okay.
Right now.
No, you're right. That's that's the right way to do it because they're the experts.
Yeah.
Thank you
All
very
right.
much.
Thank you.
Okay. Bye-bye.
Bye.
Bye-bye.
Yeah, take a seat. All right. Morning.
So, is there anything about your health that you particularly wanted to discuss today? Asthma is another of your medical problems. Is that well controlled, or
What, asthma?
Yeah.
Well, no, I have had a bit of breathing problems recently. Not bad, but I'm not breathing as deeply as I would like to.
And you're using
I've
your
had some-
medications?
Yes, I've been using that.
Do you know what triggers your asthma? What makes it worse?
Well, I think that it's the pollution,
Okay.
the heat, the pollution, the traffic,
Yeah.
the high road.
Have you had any falls, or do you worry about falling?
I can walk without the stick, but I'm not confident on the high road because of the kids.
Well,
on
the road is very uneven.
It's very
and there's lots of
uneven.
people about, isn't there?
And there are too many people, and they
Yeah.
don't notice you, and they bash into you, and I mean, I really think it's safer to have a stick. I think actually what I'm objecting to now is the scooters. There's so many of them.
Yeah, and the little kids as well.
And
They
grown-ups
go
on
ahead of
scooters.
their parents, so they can't even.
Exactly. They
Yeah.
don't know what they're doing. Parents are usually on mobile phones anyway.
But you feel well in yourself? Do you feel well?
Well, I feel a bit miserable sometimes, but mainly, I mean, it's just not getting around as much as I did.
The mobility.
It's just a bit depressing not to.
But I think
Not
also
to be
you've
as
got
active
to
as
you've
I
got
would
to
like.
remember that you're a very good age, and so you've got to you know, sometimes you've got to slow down a bit.
Yeah, I know. Well, I don't want to slow down so much. I mean, I do feel I've got to get out. That's why I decided yesterday I've got to go out. So I took myself, as I say, I went to Collier's Wood And then I felt quite pleased with myself that I got there on my own, you see, on the tube without depending on somebody else being there. And then I went to Marks and had something to eat and came back home and felt fine.
Have you ever heard of the befriending service from Age UK?
I've heard of it, but I don't think I need it. I've got friends.
You've got enough friends
I've
around?
got a friend who came in this morning, actually. I mean, I think changing the focus does help, and I think probably if I go on holiday, I will probably be able to do it.
Well, have a wonderful holiday.
Yes, it's only a week.
Well, a week is better than none at all,
A week's
isn't it?
better than nothing, yes. Okay.
All right, thank you for coming. All right, bye-bye.
When are you looking at doing your work experience? OK, so I think this coming week might be too soon. But if you wanted to write in, then I'm sure she would consider that.
That's the only time I come in. Very good. Come in, take a seat. Busy day, indeed. Always. William has been in to see me on a number of occasions to discuss his anxiety and his cannabis misuse.
I find that the weed is the only thing that keeps me sane.
When I saw him last, we discussed ways forwards for this to reduce down the cannabis misuse and to try and increase his self-esteem with a long-term view to returning to the workplace.
I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
How are you today?
Yeah, I'm okay. I've been better, but I've been worse. So
okay.
I feel like a better person, like less stressed, like more energy. I'm not thinking about the weed as much. It would be nice if I could cut down and knock it on the head completely to the point where, you know, I don't think about it, but I don't ever envisage it. I don't, not anytime soon.
Okay. And have you what's happening at the moment? Any thoughts regarding work?
I mean, I'm still at that. I say crossroads. It's not really a crossroads. I feel like I'm just at that precipice with like no real skills that I can translate into the workplace. I mean, I've had some good jobs like many years ago, like another life ago, really. And the gap in my CV is just so like huge.
Yeah.
That like I don't get the callbacks or anything.
So it's 10 years without work.
It's like 10 years without work. I mean, obviously I've done like a day here, a couple of days here, helped out and done a bit of voluntary work as well. But I feel like I'm going backwards.
How are we going to get things going forwards?
Obviously, I don't want to be on the sick. I don't want to be a benefit, like seen as benefit scum.
At the moment, we've got you're 33 and not worked for 10 years. And
I know, it's shocking.
The chances of returning to work are
dwindling as we speak. Yeah. I know.
We want you to become productive again, and you know.
I know. I had big dreams. That, like, this is what my first couple of counsellors was saying. Like, yeah, you built yourself up too high.
So
mate,
the only counselling that we would have access to is through WCDAS or IDAS or whatever we're calling them.
It's literally that's my only option from counselling.
From a counselling point of
is
view.
through the drug angle. See, I'd rather talk to a wall than talk to someone like condescending with their.
Yeah. And you've said before.
I mean, what you said before? To me, what's the alternative? Go and have a drink. Like, no thanks.
Yeah,
I'd rather die.
You've said before with the from the cannabis point of view, you use it to kind of treat anxieties and so forth. What happens if we tried another medication? A medication from an anxiety point of view. Have you been on anything antidepressant, anti-anxiety?
I was on antidepressants for about 3 months, and it was the worst 3 months of my life. Like, you know
which medication that was?
I think it was fluoxetine.
Fluoxetine. What happens if we tried something, perhaps a similar sort of medication called sertraline, and we gave it a try? Should we do that?
Yeah.
Okay.
So I'm open to suggestions because it's literally I've been on this path for like 10, 12 years, bouncing along like just blowing in the wind, literally. And
well, let's have a go because it might help to control the anxiety, and then that may well mean that you're smoking less cannabis. When we start people on these medications, we do like to review them early, so in 2 weeks' time.
Okay.
And so I'll do the sick note for 2 weeks.
Okay.
And then bring you back. That goes through to the 13th. Brilliant. Okay.
Thank you very much.
I'll see you in a couple of weeks' time.
Thank you.
Okay. Take care. And you.
No problem. All right. Bye. Good morning, Vicky speaking. How can I help?
Yep, they'll be ready to collect after 4 tomorrow.
All right. Oh, bear with me. Hello? Would you like your daughter to come through?
Yes.
Yes, please.
She's my next of kin and she does everything for me.
Hello, how are you? Come in, take a seat.
Like an idiot, because I've just been swimming and I've gone completely deaf.
Oh no.
Well, not completely, but I've got one question while I'm here. I was sorting through my pill drawer, found this packet, which is only February, and I've no idea what they're for. I hope it's not something I should be taking.
I'll tell you. That's one I don't actually know.
I can't say it, that's for sure.
So nausea and vertigo?
Oh, I know what it is. I had a very strange giddy turn.
Yeah, there you go.
And my neighbours all thought I was having a stroke.
Oh,
I was talking strangely and...
Did it just suddenly come on?
Yeah, and I was trying to use my mobile to ring somebody and I couldn't sort of coordinate properly. Oh, I can't look at that.
And it was nausea and...
I'm just trying to think of the name of it. Gone from me as well.
Was it about your ears? Was it to do with your ears, the balance?
I think so, yes.
Labyrinthitis?
Yes, that's it.
Mm.
It was very frightening because when I couldn't use the phone and I was feeling unsteady and I'd thrown up all over my flat, but I got to the front door and the dustmen were just there and they were wonderful.
Oh.
They went down the road and got my friend for me.
Did it feel like you were on a boat?
Yeah.
That's the imbalance of the ears.
Yeah. And I wasn't speaking clear. Oh, God, that's all the signs for a stroke.
And of course, once you start to worry,
Yes.
that makes everything worse, doesn't it? But it's natural to worry. There you go.
Lovely.
All done.
Thank you very much.
Pleasure.
Now I'm killing time. I've heard yesterday that I've got an appointment at George's this afternoon.
Oh,
So I've
okay.
got an appointment at the skin clinic.
Oh, you're getting around this
Yes,
week?
absolutely.
Nice to see you, always.
All the bits are being checked.
Take care. Bye-bye.
Yo, yo, yo.
Hi, Patrick. Come and have a seat. How are you?
Not great.
So it's been a while since I saw you.
I'm really feeling down. I'm feeling
Yeah.
really suicidal. It scares me at the moment.
So I had a letter from A&E from a couple of weeks ago. What happened?
I ended up going to St George's, which I got an initial assessment, and I waited for about 4 hours and basically discharged with 2 leaflets. Nothing.
When anyone ever comes in and tells us about them feeling low or feeling down, it's really important to explore with them exactly how extensive those dark thoughts are. Are they just something that they've had a fleeting thought that would be a lot easier if you weren't alive? Or actually, is it more planned than that? Have they really thought through what they may do and what steps have they taken to try that? So had you done anything to actually hurt yourself, or was it just the kind of number of thoughts of it?
What happened is I started drinking and I knew that was dangerous, so I stopped drinking when I phoned, and it was the thoughts that where it would lead.
And how much are you drinking at the moment?
I'm sort of drinking every other day, and when I'm drinking it's probably about 6 cans of cider or 2 bottles of wine, that sort of drinking.
So that's kind of crept up quite a bit, hasn't it?
Yeah, from not drinking at all and slowly coming back to it, I mean, that's what scares me. If I'm depressed and I'm anxiety, if I put alcohol on top of it, it's dangerous. It's really dangerous. Starting drinking again is a warning sign that, and it distorts everything, and then it brings in the depression and the anxiety, and then I don't know which is which. I don't know if it's alcohol related or am I using alcohol to solve it, but it's dangerous.
It goes hand in hand often, doesn't it?
Yeah.
So the drug and alcohol service, what help are they giving you at the moment, or what contact have you got with them?
I'm going to see them for an assessment. It's a drop-in, and they like you to turn up at least 3 times a week.
And how motivated do you feel about that at the moment?
I really have to do that.
Good.
because, see, I'm isolated. I'm in my bedsit. I'm feeling sorry for myself. I'm getting depressed. And it's dangerous.
Okay.
Sometimes I just feel like, oh, what's the point?
Mhm.
It's just a game. But as you say, there's not a lot you can do right now. It's a slow process.
But it sounds like it's moving in the right direction in terms of the things that you're doing.
Yeah, and the medication I'm not even too sure, but I mean, medication doesn't work with alcohol, so...
No. So how much, you're having 150 at the moment, is that
Yeah.
right? Yeah. And you're still having it every day, or?
I'm still having it, but alcohol just neutralises it or something. I don't know what it does, but...
Yeah, so alcohol's a depressant, isn't it? So it kind of switch. I mean, there's no point in having an antidepressant
Yeah, when you've got a
if you're going to take a depressant as well. Yeah. So we know that you've got a lot of insight into things, don't you? You kind of know how things go. You've done this merry-go-round.
Yeah, the counselling, it seems to be going okay. It's something I've been looking for over a year.
Yeah.
And I finally got it, and if I finally got it, for Christ's sake, tell her what's going on.
Yeah.
Because I tend to tell people what I wish was going on. I convince people I'm actually okay.
Yeah.
This other woman from Ones With Mind, she's really helpful. She contacts me about once a week.
Okay, so that's extra support there.
Yeah, and it makes a difference. And
Good.
she's the one encouraging me, do this, and it's like somebody giving you a checklist, and it's so helpful, because you just do it.
Good.
Yeah.
Do as you're told.
Yeah.
All right, it's nice to see you, Patrick.
Okay, so that's everything. Okay.
Talk later.
And then-
Okay.
Cheers.
Bye.
Yeah, a half an hour appointment, and you say that you can never get hold of me. I'll give you half an hour of my liquid gold time, and you're not even here. Oh, what? So 4 o'clock next Wednesday.
What's brought you in today?
Basically, I have been having like pain in one of my breasts.
Right.
And I wasn't sure what it could be, basically. I'm probably like a little bit oversensitive anyway because my mum had breast cancer about 3 years ago. So it's something I kind of keep an eye out for.
What's happening with the pain?
It's not really, it's kind of just like a bit of an ache and it feels like more like bruising.
Okay, and how long has it been there for?
About 3 weeks.
Okay.
It was kind of straight after my period and has carried on.
Okay, and are you on oral contraceptive or not? No.
No.
Okay. I wouldn't think much more of it at the moment
Okay.
in someone that is your age, in 24.
I was just really worried, I think, just because of
What
kind
happened?
of everything.
Yeah, understandable.
But I just
What age was she?
She's actually had cancer twice. So she
On the
had,
breast twice? Or
no, she had a lymphoma when she was about 26.
God.
And then breast cancer recently, and she's about 47, I think.
Okay.
So, because it's kind of a pattern with her, like I recently have been, the last couple of years have been kind of a bit more.
And is there anyone else in the family that's had breast cancer?
Yes, one of my great aunts on my mum's side. So she got diagnosed shortly after my mum did. So,
okay,
yeah.
but she's a great aunt.
So she's my mum's aunt.
The mum's aunt.
Yeah.
Okay, yes, yeah, okay. So I always think it's quite a useful form. This is from Oxford University with their for their cancer genetics referrals. So if your mum had been diagnosed below the age of 40, one close relative, then we would be at that point we would be saying, well, actually maybe we'll do some genetic testing. And there's a couple of genes like the BRCA gene which are closely related to that. And often then you see, if there's someone's got a BRCA gene, probably there tends to be several people that have had problems. Right. So it might be somebody that presents very young, but there could also be 2 close relatives with breast cancer under the age of 60. So we're not sort of approaching any of these criteria. So we're not really thinking about increased risk. So I think that's hopefully quite a reassuring thing to think
that is
about.
very reassuring, yeah.
I think in general practice over the last few years, we've certainly seen a difference in the numbers of people presenting with very vague symptoms who are very concerned about significant underlying causes for this.
There's so much coverage in the media of missed cancers and so much concern that any symptom could well be cancer.
If you ended up with this sort of breast pain that was ongoing and it was coming from the breast tissue, then we would refer to a breast clinic at that point.
Okay, so just keep an eye on it, basically.
We would, yeah.
Okay, cool.
The real challenge in general practice is trying to identify the patients where those symptoms are important and we should be investigating them further.
So yeah, I wouldn't worry too much about that, and then I'll just see how things go.
Yeah, okay, brilliant.
Okay.
Great, thank you very much.
No worries, take care. Have a good afternoon.
Thanks, you too.
Bye then.
$10:30, is that with Dr. Shah? All right then, take care.
All right
Bye.
then.
Hi. Are you showing the way to go?
Okay,
Yeah.
thank you very much.
Who's this? Is this your...
No, it's my friend's
Your
grandson.
friend's grandson. All right. Angela suffers from high blood pressure and comes to see me regularly to monitor this and to get her blood pressure medication. On the last occasion, we also discussed her addiction problems, and we agreed she was going to go to the drug and alcohol support team to try and help with this.
I get the shakes, you know, and I'm literally holding a can like that to drink it. I'm so sick of me. So sick of me.
Should we do your blood pressure? You've been taking your tablets?
Okay, yeah.
Yeah?
Yeah, absolutely. Come closer.
Blood pressure's great. Sorry to
Is
interrupt. I've never seen it so good. 119 over 78.
Oh, brilliant. Happy days.
So what happened then?
I broke it. I broke these bits. I can't remember. Sector cranium or something. What are you doing? Oh.
So what actually happened then? You were in a fight. Who was the fight with?
Doesn't matter.
Okay.
But the thing is, he punched me right here. It's gone down. But it was so there. It was there. It's the lump is still there. I said, if you're going to X-ray me, X-ray my head. But they didn't. But I went after 3 days after the fact. It just got out of hand. He went like that, and that was it.
How much?
So he punched you first?
He did, yeah, right, yeah. It's still there. It's still like it's going down, but it's still.
Yeah.
It was all over. It was all over. I even called the police.
You called the police?
Yeah.
And did they?
Because I took the knife and I went for him, and I just thought, Angela, just leave. I ran with the knife and everything.
Okay. So where do we go from here? Did you ever go back to IDAS?
Of course, yeah. Oh, yeah. I'm still liaising with them. I've got an appointment. Of course. I need them. I can't do this on my own. I need you all.
Do you have a social worker through them? I ask you this all the time, but...
No, I still haven't. And I've not for want of trying. No. They didn't even bother with me. I don't know why.
And this, you're seeing someone,
Yeah.
is she like your caseworker? Or
She is.
Is she good?
It's very hard for me as a 44-year-old to deal with somebody who's in their 20s to tell me what. You know, it's embarrassing. I feel embarrassed. But,
What kind of things do you talk to her? Is it
I
focused
don't talk to her about anything, to be quite honest.
Okay.
With you. She's too young. I can't work with her, to be quite honest with you. I've got children her age, man,
Yeah.
or a child, my daughter. It's not cool. I don't feel comfortable. I really don't.
I mean, you can say that. You can say it doesn't need to be a personal thing, but due to sort of age difference, it's not someone I feel...
Isn't that not age discrimination?
No. It's completely within...
Ageism? Is that what they call it?
Yeah, but I think it's fine. So it has to be somebody that you feel you can speak to and can help you.
I'd rather somebody else I could speak to.
I'm going to try and just speak to them at IAT as well about this. If you can give this, I've just put it together with the appointment. This is a letter. If you can give that on Thursday.
Yeah.
Do you want to ask for someone different? That's up to you. I haven't said
No,
anything. I don't want to
no.
compromise. I'll give you 3 months of your blood pressure tablets.
Yeah,
Make it awkward
I
when you see
appreciate
her.
that.
Okay. There's the prescriptions, months of each of these. Okay.
Come, let's go. We'll get some outside. Thank you.
Fine. Well done. I will
Thank
see you. That's
Thank you very
fine.
much.
Blood pressure's very good, and we'll
yeah.
see. I'll try and speak to IAPT and see what they say.
Thank you.
Okay.
टाइगर जैसा करके खाना
कैसे
ऐसे
सब इकट्ठे करेंगे
इतना बड़ा
Hi, I'm Sean with the doctors. I'm good. Come in.
Thank you.
What can I do? I'm good, thank you. Yes.
Excellent.
What can I do for you?
Well, my wife and I are trying to have a baby.
Yeah.
And she's come in, she's a member of the
Yeah.
same place as well. And
Yeah.
we've been trying for a little while now.
Yeah.
I know that we're in our mid-30s, so we wanted just to kind of like see,
Sure.
I don't know, maybe have a test to see how we're going. And, you know,
Sure.
I think she's already kind of had the first stage of testing done.
Okay.
And so that was just what we were kind of like hoping for. So, yeah.
Fine, fine. How long have you been trying for now?
I would say probably we tried a little while ago, and it's probably been about 6 to 9 months now we've been trying for.
Okay.
So, yeah. Just getting that little bit of concern in place now because we've been trying to
Sure.
follow a schedule, see how it works, and nothing's really taken flight yet. So.
Okay, fine. And then she's come off the pill again, or?
Oh no, she never went back on.
She never went back on it.
No.
I see. So you just stopped using condoms, or?
Yeah,
something like that?
that's it. Yeah.
Yeah. Okay. And how often are you having sex?
I'd say probably, I don't know, maybe like over the period, kind of like the window that we're given.
Yeah.
You know, we have one of those apps on your
Yeah,
phone,
of
so we have like
course.
4 or 5 day period or whatever.
Yeah.
So we probably have like sex at least once a day over those times.
Okay.
And then in between, probably, I don't know, maybe 2 or 3 times.
A week?
Yeah. I know, probably in between the time. Because of work and everything, it's hard to
Okay.
find the time. We
So
try,
yeah,
but
so 2 to 3 times
the other 2
outside of the
weeks,
fertile window.
Yeah, that's it, yeah.
And what's your lifestyle like in terms of? You don't look overweight.
No, thanks. Oh, I try and work out. I exercise. I play football once a week
Okay.
and go to the gym as well.
What about smoking?
No, I used to smoke, but I gave up about 6 months ago.
And alcohol?
I'm not a big drinker. Maybe like 4 drinks per week. I would say something along those kind of lines.
Yeah, not excessive at
No.
all. So there's probably not much you can do lifestyle-wise because you're already leading a pretty healthy lifestyle, really, aren't you?
Thanks.
Okay.
Yeah, no, I tried to, definitely.
Yeah, okay. I mean, let's get a semen analysis
Yeah.
done for you, okay? And then we can see what that shows. You know, the majority of people will get pregnant. You know, so sometimes it's just a matter of time.
Yeah.
You know, if we can't find a problem,
Yeah.
let's just keep having sex and
Yeah,
it
yeah,
should
yeah.
happen.
Yeah, of
You know,
course.
probability-wise, even in your age group, you know, sometimes it would take longer than a year. But I think, you know, we would potentially refer you in another 6 months if you weren't getting anywhere unless we found a problem.
Come and have a seat. Right, Dr. Beecraft, how can I help?
First of all, I had this this cough going on for a week now, and I know it's probably you've heard loads of people going on about their coughs, etc. But like I say, it's keeping me up all night. Can you give me some antibiotics for that?
Fine, let's have a seat. So, are you a smoker?
Yes.
How much do you smoke?
About I don't know, 6 cigarettes a day.
Okay.
Yeah.
And is that something you've done for a long time?
Yeah.
Yeah. Okay. And what are your thoughts about your smoking?
I don't have any thoughts about my smoking.
Do you think it's a good thing or a bad thing? Or?
It's not making me cough.
Okay.
It's something else making me cough.
Let's have a little look. Let's pop that on your finger. And what is it you do for work?
I'm not working at the moment.
Okay. Right, well done. Slip that off. And can I get you to stand up and we can have a little listen to your chest? So nice, big, deep breaths in and out for me. Okay. Right. You have got some extra noise in your chest, so yes, I think you do need some antibiotics. I was just looking at your notes before you came in and saw that actually we never see you very often, but when we do, it was kind of about a similar thing back in December. My worry is you're getting these chest infections relatively regularly, and that's probably related to the smoking. When you're younger, you smoke and it doesn't really affect you, but over time, it will start to build up, and this is often what the pattern we see is people then start to get ill more quickly.
Okay.
So I think we need to be a bit careful about your smoking.
Okay, I'll quit then.
Have you ever tried to quit before?
Yeah, I think I've quit for a couple of years before. and I have, you know, it's part of my sort of my morning thing. I have a roll up in the garden. Yeah, I'll work on that. I mean,
because we've got some of our nurses here do kind of a stop smoking kind of session.
Yeah, and I think it's about you deciding to do it. Really,
yeah,
it's the,
so it's
the
kind
main
of
thing.
motivation. I think
Yeah,
is coming from you. But okay, I'm sorry, 3 times a day for a week.
Yes.
And then leave it a few weeks and then come back and see me.
Right.
And make it a double appointment.
Yes.
Okay.
Okay.
All right. Take care then.
Cheers.
Bye.
Hello. How are you?
I need to pee. I need to pee, Aaron. I'm gonna go.
I'm so tired. Oh, I'm totally broken.
Really?
I had one of those big pints of Red Bull, so I'm going to go and have another one of those.
Plus.
Okay. Red Bull.
Onwards.
You get in there. See you, mate. See you.
See ya.
The only thing is, sometimes if you have sex too much, your semen quality goes down.
Okay.
So potentially I would say during that fertile period is perhaps not have sex so much.
Okay, all right.
So probably 2 or 3 times a week
Okay.
consistently is probably better
Yeah.
than every day during that
Okay.
fertile period. Yeah. Let me get a semen pack for you. So this is the pot. So no ejaculation for 2 to 7 days, okay? Wash your hands, obviously, no lubricants. You masturbate into here, okay? And you need to collect all of the ejaculate, okay? Name, date and time on the bottle.
Okay.
And then you need to get it to the pathology lab within an hour of doing the sample.
Okay,
This is the
all
tricky
right.
bit.
Yeah, okay.
The other problem is that the hospital is not the local hospital.
Oh, okay, all right.
Logistically, you've got to think if that's possible.
Quickly.
Okay.
I've got a car, so.
If it's not possible, okay,
Yeah.
then they can arrange for you to have a room in the hospital.
Okay, yeah,
To masturbate in, okay? But you need to book
Everybody's
that, pre-book that room, okay?
All right, no
I don't
worries.
think a horrible hospital room is be very pleasant, but you'll just have to think how long it's going to take you to get there, what time you go.
Okay.
And keep it warm, okay, in your
Yeah.
pocket. Okay?
Okay, all right, no worries. All right.
Tray. Okay?
No worries.
And then we'll find out. Hopefully it'll be fine.
Okay, all right.
Good luck, okay?
Well, thank you very much. Appreciate it.
And we'll get the result, and then you can give me a call for the results, okay?
Okay.
Once you've done it.
Oh, wonderful. Thank you very much for
all
your help.
right.
Appreciate it.
Bye-bye.
Well, I might still be here, but I finish at 7, so you might just catch me on the way out.
Okay.
Thank you
No,
very
it's all right.
much.
It's all right for you. You can jump up like a whippet.
Thank you, Doctor.
Okay.
Good. All right. Take care. Bye.
Go on.
She does.
Very good.
Good girl. Thank you.
All right, take it easy.
Good morning, Anisha speaking. How can I help?
Hi, Jackie. Hi, come on in. How are you?
I'm good, thanks. And you?
Good, fine. I've got Dr. Dillon with me, who's just started with us. So So she's just watching at the moment. Right, how are things?
Fine, but it's really daft, but I got a bee sting on Saturday, and it didn't hurt really at the time, but yesterday and today it's swollen up and it's so sore. So I just went to the pharmacy just to see what can I put on. I've been putting Antisan on it.
Okay.
And I've taken Piriton, but it's just so sore and itchy. But he said, oh, I think it might be infected because it's a bit hot and throbbing. So he said, oh, just see.
So this happened on Saturday?
Saturday.
Yeah. Okay. And I'm just going to squeeze your nails, so I'm just going to be a bit sore for you. I'm not actually convinced that it's infected.
Oh, good.
It's really difficult with fingers because if you'd kind of got bitten here, it would just swell and it would be able to swell a lot. Whereas with fingers, for some reason, they can only just swell a tiny bit.
Right.
And if they get to a point and they just get too tight and it gets really sore and throbbing, which is what you're
this is what it's like, but I'm sure that's fine then, do you think?
It is fine. So antihistamine is the right thing to do.
Okay.
The other thing that would be really good is if you can elevate it. So tie your arm up so it's around your shoulder. That would just help gravity to kind of get rid of some of the swelling, and hopefully it would get better. But I don't think it's infected. They're a pain, aren't they?
I know. I mean, I have been stung before, but I can't really remember it. But honestly, even at night, I've been waking up because I've been going on it, and it's so hot and sore. Right. That it?
That's all.
Don't need to do anything. Lovely.
No, fine.
Okay.
Keep doing what you're doing. Yeah.
Lovely. Thanks a lot.
Bye.
Bye.
Oh, and then guess what? When I went home yesterday, I'm like, what's that moving? Them proper ones with a big, long leg spider, thin one, Literally, it was right where I had walked into. So I was like, oh my God, I just touched that. Nastiness.
Nastiness.
Hello, come through. Please have a seat. I'm so sorry to have kept you waiting so long. I apologise for that. How are you?
I'm all right.
Great.
I don't know if you remember, I had a spine fusion
Fracture.
operation, to sort of fuse the fracture. I don't know whether this is related at all, but since that operation, I've had these weird, and they're very difficult to describe, these weird pains all down through my legs.
Frances had originally come to the surgery a number of months after she'd fallen over in the snow. She had significant back pain, and an X-ray actually showed a broken bone in her back. She went on to have an operation to stop the pieces of bone from moving around, as it was thought that that was what was causing her back pain.
The minute I lay down to go to sleep, turn on my side, and then it's like electric shocks just whizzing up and down my legs, all around my knees, hips, ankles. It's really distracting, and sometimes I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
Had you ever had it before the operation?
No.
When did this start?
Well, it's hard to describe because it's kind of crept up. I'm just sitting like waiting for you then. You know, I had sitting like that and like get pains down here and it's weird. But going to bed, I sort of lie there and it's like, okay, it's starting. I can feel it starting. And then they whizzing around, bizarre electric shock type pains.
Electric shocks.
That's sort of what it feels like. They kind of creep up on you and then they go they whiz.
Do you have pain in your back now?
No, the bone pain went immediately as soon as they fused the bones. The muscles have taken ages to heal.
So these pains, is it mostly in your right leg or your left leg or both?
Mostly my right leg.
I might ask you to pop your trousers off if that's okay. Jump on the couch and then there's some more blue roll that you can just pop on your lap if that's okay.
Yeah.
And if you give me a shout when you're ready and I'll come through. Great, so I'm just going to check all the nerves in your legs if that's okay. What I'd like you to do now is push up off the bed with that leg and now that side and pull down and the other side and bend your knees up for me and push me away with that leg. Push me away, pull me towards you. I'm just going to lift your leg up and rest it on my arm. I want you to go completely relaxed and floppy. Good. Feel free to pop your fingers on, come and have a seat. Right.
It's weird, isn't it?
It is. I'm not completely sure what the problem is. What I'd like to do is do some blood tests to check some of your vitamins and sugar control and stuff like that, and then see you with the results, and we'll make a plan about what to do. Does that sound okay?
Yeah. But you don't think it's from what they've done on my back? That's what I was more concerned with, that it was...
No, I don't.
You know,
Because the nerves which supply your legs come out much lower down.
yeah, okay.
Okay.
Right, thanks.
No problem.
Thanks very much.
See you again.
You're making tunes for us.
My neck hurts.
What are we up to?
Apart from being very, very angry, now I went to St George's. I got there at 2 o'clock. She looked in both ears, clogged up with wax.
Right.
So she said, you have to see the doctor in order to get syringed.
Right.
3:25, I was rather miffed because I was still sitting there.
So I guess what's happened is you left without your hearing test. And you came the other day to get your ears syringed, and there was a problem there. And so your ears are still filled with wax, and I'm going to need to refer you again to get them sorted out. Is that right? Is that where we're going with this story?
More or less,
Yeah,
yes.
okay,
But
fine.
the thing is, I'm absolutely furious.
Let's have a look at the ears now. So what were you coming to tell me today, just about this story? Was there anything new?
Well, actually, I was coming here, hopefully with clean ears, in order to make another referral. Because I came to the conclusion, that referral you done the last time.
So I've done several referrals for this.
I really understand with Ian why he was so frustrated at being kept waiting at his hospital appointment. The problem is that all the clinics and services are really overused and oversubscribed, and so inevitably there are delays in treatment. Sometimes I think people forget that. People will get the care that they need, but often it may not be as smooth as they'd hope.
But at the same time, I'm not impressed by these olive oil drips, because every time I put the cotton wool in and take it out just before going to bed, it's just like, it's just the staining of the oil.
So the reason we get you to use the drops is hopefully it will encourage it to come out, but if not, it softens it, so it will make it a lot less painful for you to have that wax removed. So I know it's a bit of a nuisance having it done, but similarly, it needs to be done for us to get the wax out.
Yeah, I understand that. What I was thinking, though, is like going back to an old and tested method which worked, was getting the olive oil, not the drops, heat it, and then pour it in, and then put in the cotton wool, because the heat from the olive oil going in is going to melt it a lot quicker than cold olive oil.
But it will also damage the skin in the ear. So I wouldn't heat up oil and put it in your ear. I think that would be a disaster.
I'm not saying it's going to be boiling. It's just...
You'd warm it, but...
Just warm it.
Yeah, I probably wouldn't do that, Ian. If it were my ears, I definitely wouldn't. Had you just sat there a bit longer at the clinic, you probably would have wax-free ears now. I know it's a nuisance when you're there, but it's just delayed things for you anyway.
I've got other things to do rather than sit around waiting.
I do get that, Ian, but at the same time, you're going to not have your hearing so well for the next couple of months while we get this sorted.
Nothing unusual then, is it?
Okay, right, all done.
Is it?
Yeah.
Right. I will sort that out.
Okay.
Bye.
Bye.
There's nothing especially wrong, but there is something that's concerning me, and I don't know whether it's something or whether it's nothing or what. But just to give you a bit of background, my best friend was diagnosed with ovarian cancer 2 months ago.
Okay.
And I don't know whether it's just because it's very close to home and I'm seeing her and speaking to her every day, that it's making me concerned about ovarian cancer, other types of cancer, just all sorts, really. I appreciate that this is probably so stupid, but when I push in my ribs here, I feel like I'm pushing something back. Whether it feels like, I don't know if it feels like a gland or I don't think it's a lump, and I feel like it's always been there. Like it could have been there 10 years ago, but it never would have worried me. Never thought anything of it. But now, because my mind is just like in overdrive, it's kind of was nothing, and now it's something, and I almost just need to come and speak to someone, and just so I can.
Sounds like you did need to.
Yeah.
So let's feel your tummy and see what there is. So hands are cold. So actually, show me where you felt at the top.
Here.
Yeah.
So actually, if I'm lying down now, I actually can't feel anything. But you know what? I just find myself there all day going.
Feeling it.
And now, and then I think, because I think that's, I feel like I can feel something constantly, and I know the minute I'm not thinking about it.
Okay, let's start with this and see. Okay, tell me if you get any pain at all. Okay, so when I did that, not painful anywhere?
No.
Okay, let's get you to stand up. Okay, and then show me where, feel it if you can.
If you put your hand there,
Yeah.
I feel like I can feel something.
Okay, yeah, I can feel that.
And then just
you
a little
think
bit,
it's the
and
same
then-
on this side or something on this side. So the same place?
Yeah.
Okay. That feels like muscle, actually.
That's it.
It's, that actually is one of the big muscle groups in your abdomen that we're feeling.
Okay.
As you felt elsewhere, you've got obviously the main big muscle groups, which are in the middle.
Yeah.
And there you can clearly feel those in
Yeah.
you. But I think that's what we're feeling in this case.
Right.
In terms of organs,
Yeah.
you have the liver here, and I
Yeah.
can feel that.
Yeah.
The spleen's kind of at the back, right at the back here.
Yeah.
Then you've got your kind of kidneys there. You
Yeah.
can't feel those there, further at the back.
Yeah.
Your womb would be about here.
Okay.
Bladder and womb kind of all level, and your ovaries will be somewhere like here.
Mhm.
So it's miles away from
Yeah.
where we're feeling.
Yeah.
In terms of what you felt, I'm definitely not at all worried.
Right. Okay.
Okay.
That's as I said,
Yes,
my
no,
friend didn't have anything like
fully
that at all, and
understandable.
she's the same age as me, and it's completely come out of the blue, and it just makes you question everything, I think.
Yes.
But yeah,
How did she find out then? What happened?
So she said in the morning she'd lie down, she'd press her.
Oh, and she felt something.
And she felt a lump, and so she was just like, I really should just go and check this out and just put her mind at rest. And then fast forward 2 months, she's had a full hysterectomy, cervix, ovaries, everything out. Luckily, she's already had her kids, but now she's just recovering from that operation. She kept saying, as long as, if anything comes out of this, if you're worried about anything, you just go and get it checked out. And which is why I came, really, just to sort of, I'm sure I'm probably being stupid, but...
No, but as you
Just
said,
need someone to
it's
tell
worth
me.
checking out. It's
Yeah.
worth checking it. And something you don't know what it is, it's worth checking.
Yeah.
So in this case, it's fine.
Great.
But if you do find anything else, do come back.
Wonderful. Okay.
All right?
Thanks very much.
All right, bye-bye.
Bye.
See you.
It's like musical rooms out here, boy.
They've all just shuffled around, so they're in different rooms, but we're aware of where they are and stuff, so it's fine.
Come in. Hello. You all right?
Up there, around here, and the car. Yeah.
Oh, no, the room. I get moved around a lot.
Yes.
It's very unpredictable. So, in terms of your blood results, we've been trying to decide whether or not you needed to go and see somebody about this tummy pain.
Yeah.
Over a number of appointments, Leslie and I had discussed his abdominal pain, his diet and his lifestyle.
I buy some, what they call, not chicken nuggets. I eat, like, say, 30 of them in one go.
The last set of blood results was completely normal. And I think, actually, you probably don't need to go and see somebody about your tummy pain unless it's bothering you.
Unless the blood tests come back a bit.
No, the blood tests are normal. Because we've talked about your diet quite a bit and the fact that it can be very erratic. I think that you can get some tummy pain if you're not eating a regular and healthy diet.
That's right, yeah. And that's why I go to these nutrition classes. So I've been to a couple and, you learn a lot. Initially, you walk out the building thinking, oh, yeah, next time I get money, I'll go and buy some of this, some of that, some of this, some of that. Because when I get the money, it goes on what I normally buy. I think to myself, well, I should really buy a whole bunch of salad.
Yeah.
And you know, just eat like a rabbit for a week or a couple of days. You know, that's what you call it, rabbit food.
Rabbit food. I didn't know you were going to nutrition classes.
Yeah, we had one in the house. And,
what kind of house is it that you live in?
It's like a hostel. I was offered a place 2 years ago and I didn't take it.
Okay.
Because of their rules.
Yes.
Their rules being you can't have a beer.
No.
And it's not so much that, you can't have a beer outside. So I'll give that the elbow. But this place here, they don't say you can drink, but if you do drink in the house, just drink in your room.
Leslie and I have talked about his alcohol consumption. I'd really like to work with Leslie to try and help him to eat a healthy diet and to try and reduce his alcohol consumption.
So let's conclude. Your tummy pain, you've had it for 20 years.
Well, yeah.
It's not too bad. We know your diet's very erratic, and you've told me nothing like a swallowing problem or bleeding or weight loss, which makes me worry.
Okay.
Okay?
Yeah.
Lovely. Good to see you again.
Yeah.
So come and let me know if this tummy pain is worsening, and then we can do a referral.
Yeah, okay.
All right?
Yeah.
Yeah. Bye.
Where's the sandwich list?
Egg and cress.
No, I don't want egg and cress.
I don't know, something like chicken, like, no, New York.
Tuna and spring onion.
Tuna?
And spring onion. You only did tuna and spring onion, isn't it?
Never had that one before, but spring onion is quite nice.
Hi, Mark.
Hey.
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah, well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary.
Yeah.
Like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not like regular, but they're still quite sort of, it can last for an hour or two, sort of thing. I'm quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not that regular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
Yeah.
I think you're unwell at the moment, and I do genuinely think that you will get better.
Yeah.
I do have that hope.
Yeah.
That you are ill, and I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well,
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive. Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
You know, in terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we wouldn't want you to do anything when you're not, well.
Yes, sure.
That has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the psychiatrist by then, and
yes.
It'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.
See ya.
Bye.
Nothing for today, I'm afraid. Oh, actually, I've got a 4:30. That'll be with Dr. Pierce. Yeah. What's the date of birth?
What was the appointment for today?
It's itching. I'm getting these marks around this area. It's mainly upper body and around neck as well.
Okay, let's have a look at the rash a little bit more.
You want to take off?
Yeah, if we lift this up, see where the main bit of rash is. Okay, it's quite noticeable, isn't it? Do they come up as little pustules or?
No, it's the same, but it's very irritating,
Yeah. Okay, and do you share a bed with anybody at home?
No.
Okay. How long have you had the rash for?
This is, I think, about 4 or 5 days, this front side.
And it's very itchy?
Yeah, but the back one, because I can't see it. So...
The back's where it started off, though?
But I think it's not much now, probably.
Yeah, it's not a very specific one, but has been itchy on there.
Yeah, but it's a long time. But the last few days, it's just mainly here, and then yesterday I had a very bad towards the neck. It was like here.
Just very itchy around there. And what do you do work-wise?
I'm an accountant.
I'm an accountant, so not exposed to anything
doing
accountancy.
No.
I wonder, just looking at the rash, whether or not it could be a type of rash called scabies, which is caused by a little mite that lives on the skin. It's the sort of thing that you can pick up, sort of sleeping in a hotel bed or anything like that, where somebody else...
It's the same bed I'm sleeping, and it's not being shared with anyone.
Scabies is the name that's given to a condition where the skin is infested with a small mite that lives just under the skin surface. Some of the myths associated with scabies may be that it's a disease that dirty people have, but in actual fact it's something that we can pick up at any time. This will be something that they would have come into contact with a number of weeks before, maybe really anything up to 6 to 8 weeks before the itching has started.
And yesterday I requested the antifungal cream for because I feel smell down the bottom between legs and armpit.
Let's have a look at the armpits as well. Let's have because we might just try a tablet from a fungal point of view. Okay. And in there, so it's very itchy around here. Yeah, it could be. It's not very classical of intertrigo. And a similar thing in the top of the groin.
Yeah, here. It's not itchy,
Yeah.
but it's a smell.
The antifungal cream tends to improve that, does it?
Yeah. Because it's after a long time of having it, because it's worked really good.
Well, let's try a slightly different approach to it, and we'll go down the route of a medication, like a tablet form of the cream. The areas where this is happening, whether or not there is a fungal component to it, it's difficult to know. But we'll see what happens with this rash over the next 2 weeks. Okay.
Thank you very much.
Take care. Take care.
What we can do for you is we can either book the next appointment, which will be next week, or if you don't feel able to wait till then, I can get an on-call doctor to call you today. Are you available to take a call today?
Come in.
Well, it started Monday. I've got an abscess or a boil in my mouth. Can you see where it's swollen?
I can, yeah.
Right, do you want me to open it up?
Well, when did it start?
Sunday night, yeah, I didn't think it was. I think it's there on my gum. Can you see it?
Yeah. Let me just wash my hands.
Well, I just washed mine before I came out, but yours are probably cleaner. But I can't figure out why it's affecting my cheek.
So, what did you notice, first of all?
Monday I woke up and I went, oh, something with that. Because I wear a little plate, and it's near where the plate is, so I don't think that's doing it.
When did you notice the swelling of the cheek?
Oh, this morning. I didn't even, I got up, I had a quick wash and that, whatever, I need a bath tonight. But I washed like that, I was in a hurry, I went like that, took those bits off as you do. Once a week, shaved tonight.
Yeah.
And I got somebody went, what's up with your face? I went, what do you mean? I said, well, there's a big swelling on the right hand side.
Let's have a look then, so. Can you put your tongue on the top of your mouth like that?
I can do that.
Not quite, just at the front of your mouth, so like that. Okay, fine. And then just relax. Okay?
Okay.
And does this, I'm just going to press on you. Does that hurt?
Not in the cheek.
Yeah.
Where is it? You can press the bit that you think it is.
Tell you what, just, can you lift that up? That's
How's
great.
that?
Oh, it's a nasty infection, isn't it?
Oh, well, I don't know how I got it. Brush my teeth and all that.
Can you do me a favour? Can you get both of your hands
And what
lift
both
it?
Right, hold
Yeah.
on, hold on. But how's that?
Yeah. That's great. Okay, fine. When did you last go to the dentist?
So that was 2 months ago. I'd never have any trouble with the
so you
dentist.
went 2 months ago.
Yeah, they put it in. I'm due for another checkup.
Did you smoke?
No, I stopped. I'm stopping. I've seen Mr. Passois at the moment since last September.
How many years did you smoke for?
A lot of years. Since I was 16 or 17.
16,
yeah.
so 45-ish years.
But I've been chewing a lot of gum, but that wouldn't do it, would it?
No. What about alcohol?
I've cut back down on that and all.
Have you ever drank in excess?
Maybe years ago. That stopped in the last couple of years, pal.
Okay.
Sorry.
Okay. That's
Yeah.
fine. That's okay.
Aye, maybe I've done something that
It
touched
could,
it and I
I
shouldn't
think the
have
most
done.
likely thing is an infection. I
Could
agree,
have
it's a
been
bit
me taking the
unusual.
gloves off, and sometimes you go like that if you're sweating on site. You know.
So what, I'm going to give you some antibiotics to treat the infection. Probably be a good idea to try and see your dentist as well.
Right.
Okay. I'm going to give you some mouthwash
Right.
as well
Okay.
to use just to keep it all clean. So you're going to take some ibuprofen 3 times a day with food.
Yeah.
So that's for pain and swelling. If you're still in pain, you can take paracetamol on top of that.
Going to be high as a kite.
In a couple of weeks, if there's any problem at all
Make
with
an
your
appointment.
gum, you need to come back. Because in people who've been heavy smokers, especially if you've been drinking drinkers as well, we always need to make sure that everything heals up properly. Because if
Right.
it's not, sometimes it can be a sign of something nasty like mouth cancer. Okay? All right.
Thanks very much for your
All
help,
right.
doctor.
Pleasure.
Shan? I'm saying it wrong, isn't
Shan.
it? Shan.
Yeah.
Shan. Right, Shan.
All right.
Thank you very much.
Bye.
Aaron speaking, how can I help? Have you brought a urine sample in today?
No, I didn't.
One of the tests is a stool sample. Okay. So you'll need to drop that off for us if you don't mind.
Are you able to provide one quickly now?
It's touch and go. I can try.
I've brought a sample because I hope I'm pregnant.
Okay.
Yeah.
Good.
Don't know if you need that.
I don't actually,
Okay.
but I would know it's good to bring it. We don't tend to repeat them here, but I'll ask some
Okay.
questions. The tests that we do here are exactly the same as the ones you buy over the counter. So, when was your last period? Is the first question.
29th of
What do you
June.
mean? June. Okay. And your periods are normally quite regular, are they?
Well, they are, apart from, I don't know if you've seen, but I've had 2 miscarriages and one was recent, so I actually haven't had a period since the
then.
last one.
So that period you're saying on the 29th of June was...
Yeah, the
A
miscarriage.
miscarriage, okay. Yeah, I'm sorry to hear. I saw that. I didn't realise you'd had one before as well. When was the previous miscarriage you had?
It was
In April. Okay. And were both of them early in the pregnancy, or?
The first one was about 8 or 9 weeks.
Okay.
And then
Okay.
the last one was like 6.5, 7 weeks. So,
Okay. So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Miscarriage is quite common in early pregnancy, particularly in the first trimester, which is the first 12 weeks of pregnancy. Clearly, it's always very upsetting whenever a miscarriage does happen, and it's understandable at her reaction at being very worried about this new subsequent pregnancy. However, having one miscarriage does not significantly increase the risk of having a future miscarriage.
Any little twins, I'm like, ugh.
And what happened last time? Did you have some bleeding or pain, or how did it come to light?
So the first one, yeah, pain and cramps. Well, the first one started with sort of a little bit of brown discharge, and you know, you convince yourself that that's okay because it could just be old blood, etc. And then, but I did sort of have period pains, and the second one was earlier, and it was the same sort of thing.
What a hard year you've had. That's
I know.
No, not good. Okay.
I saw it this morning.
I know you did.
Well, what with my foot and how I feel, I don't feel good at all. That's why I left a message this morning that I thought I had some more steroids, but I haven't. So that's what I need, I think. It's been a job to breathe. Breathe through my mouth, not through my nose. It's been blocked up.
Your nose has?
Well, I keep blowing it, you know. But
Okay. And how long have you been having difficulty breathing for now?
A couple of days.
A couple of days?
Yeah.
Okay. You seem more breathless than normal.
Yeah, I am.
Yeah.
I can't do anything without sitting down.
Okay.
All right if I sit for hours, I can't do that.
Can I just check your temperature? And check this side.
I don't think I've got
No. Have you been managing to look after yourself?
Yes.
Yeah? Can I pop your finger in there?
And my foot is killing me.
Have you got an appointment yet?
I've had it. I phoned them up.
Yeah.
They gave me a boot. Well, that's a joke.
Ah.
I tried wearing it, and what that does, it takes you off the floor that much.
Right.
So your hips ache because you're walking out all out of line. No good. It is very difficult, very soul destroying.
I think the hard thing is I don't think there are any other options really.
Well,
apart
that's what
from
he told me.
painkillers and
Yeah.
time. Your oxygen levels are quite low today.
And
They haven't been this low for a while. One option is to go into hospital.
What can they do? I like your dress.
Thank you. It's new.
Nice, nice and bright, nice.
If you sit forwards for me. And just breathe in and out for me.
I had the blood test this morning.
Okay. So obviously your breathing's not so good today. It's quite a lot worse than normal.
Yes, I know, from what I can do.
And your oxygen levels are quite a lot lower than normal as well. One option is to go into hospital. The other option, which is potentially more risky, is to try and look after you, you know, here and at home.
Well, if I could have another go here at home.
Okay. The benefits of staying at home compared to going into hospital is that there's less waiting around. It tends to be a less stressful environment for their recovery. Also, they tend to sleep better as it's less noisy. And also there's a reduced risk of infection. If we felt it was safe for somebody to stay at home, we would always try and keep them at home. But obviously we need to take their wishes into consideration as well.
If you tell me exactly what I've got to do,
Yeah, okay.
then I'll do it.
Yeah, I'll ask the respiratory nurses to come and visit you tomorrow.
Yes.
Okay? But if you have any problems, call the surgery as well.
Okay.
Yeah? Because we can
What
help.
such as problems?
Well, look, if your breathing's getting worse or you
Yeah.
can't manage at home.
Yeah, well, I would tell you. then.
Yeah? Okay.
Thanks a lot.
All right.
Yeah.
Pleasure.
Thanks very much.
And I'm seeing you next week, aren't
It
I?
was raining when I came.
Looks
I
like
had
it's
to
stopped
back
now.
off. I think it's all right. Thanks, Doctor.
All right. Bye.
Thank you.
By the way.
what may be worth doing, given your history, is getting you an early scan in the pregnancy.
Yeah,
so
that'd be
we can
good.
check everything's going okay.
Yeah, that was one of the things I wanted to talk about, and then just if there's anything that I can do. Obviously, I'm willing to just try. I've stopped running, which probably I don't know if it's a good thing or a bad thing. I'm really trying to do everything I can, so at least then I can say to myself, with nothing I've done.
Yeah, and I think that's normal to do that, and I think that's probably an appropriate thing to do. There isn't any evidence that running in any way will affect or doing sport will affect it, but human nature being what it is, it's not. If that's the decision made, that's fine to do that. Yeah. To be honest, whether it makes it better or worse, it's mostly out of your control because it's more to do with the DNA of the embryo that's forming rather than anything that you are doing. I think it's really, really hard when you've had such a difficult year. I think the best thing we could probably do is figure out your dates now and try and get you a scan in about 7 weeks so we can see, and there's an early pregnancy unit at St George's.
So what will they be able to see at this early stage?
And hopefully at 7 weeks you should be able to see a heartbeat, you should be able to see the gestational sac in the womb, and if they can't, what they would do is then bring you back the following week so they could scan you again.
Okay.
All right.
Cool.
Okay.
All right.
Do you want me to dispose of this?
Yeah.
I don't really want to carry around.
Lovely.
Okay, well, I hope it all goes well next week.
Yes,
okay.
I'll let you know.
Good.
Thank you very
All
much.
right. Bye.
I'm not too sure. Bear with me a moment. Is ear syringing messy?
Messy?
Can it get messy? Yeah.
No, they won't get messy.
No, it won't get messy, no. All right then, okay. Bye.
So have you had your ears syringed before? No. Irrigated or anything, no? It's not a painful procedure, it's just feels a bit weird, warm water in your ear.
Okay. Yeah.
Just come and take a seat over here. Thanks. So if it does start to hurt, because it's not supposed to, then let me know and I'll stop. I'll put this here, don't get wet. Hold this cup under your ear like that for me. Look straight ahead. Keep your head just like that. Like that, straight ahead.
Yeah. Cool.
You ready?
Yeah. Oh, wow. It was alright, actually. Whoa.
There it is. Quite little lumps come out.
Oh my day.
What?
Oh my day. That sounds bizarre.
How does it feel?
I can hear you. You sound like you're shouting.
Have a look in the cup if you want. Does it feel good then?
It feels amazing.
There you go. Let me have a look in quick.
Oh my god.
That's the best reaction I've had.
I'm gonna listen to some music tonight.
Yeah, enjoy. All right, let me just move you around here just a little bit. That's it, and then out. All right. And just look straight.
Yeah.
I'm gonna begin, yeah?
Yeah.
There we go. Wow. Wowee. That was even bigger.
Seriously?
Have a look.
Oh my goodness. Oh my god.
What? The hearing?
Oh my goodness.
It's weird, isn't it? Let me have a look.
That is amazing.
Let me just look.
You don't value
Your hearing.
until it gets taken away from you, like from the guts or something.
You see the big lumps in there?
I see.
Mm.
It feels weird. I can hear myself inside.
Right, there you go. 2 crystal clear ears. Oh, sorry.
Oh my goodness. I'm meant to feel like this. I can hear myself inside.
Because you're not used to having their normal hearing. They've been blocked up God knows how long.
Yeah.
So this is how sound should usually be.
Okay. Oh my goodness.
There you go. Happy?
Yeah. I'm more than happy.
Good. There you go. All right. Take care. If ever you need it done, again, you know what to do. Take care.
All right, nice to see you, Barbara. Bye.
Nice to see you. Take care. Bye-bye.
All right.
Love to see you.
That's okay. Thank you.
Okay, I love you. Thanks for seeing me.
No problem.
Yeah, thanks a lot.
Take care.